And when you look at the average cost per breach for a covered entity, 2.2
million.
And then a BA.
Yeah. $1 million. Hold on, let me get my little pinky, put it up on my face. $1 million. Yeah, that's crazy.
Yeah.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
Welcome to the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs, and joining me, as always, Donna Grindle of Card and Compliance. Good evening, Donna.
Yes, good evening, David.
Yeah, we don't normally record in the even hours. This is different.
Yep, scheduling snafus.
Yeah, we'll be talking about some snafus today.
Mm-hmm.
So last month, the Poneman study, 6th annual of healthcare breaches, came out. And since last year was the year of the healthcare breach, we've got some interesting data in the study for sure.
Well, and we're just starting 2016 and we know it's going to be insane. So I like watching the fact that in some ways nothing changes. Even though there's a ton of breaches, nothing's changed.
Yeah. And, one thing that we talked about that I guess is worth mentioning now is that we've been talking about ransomware recently.
Yes.
And I think it was like the day after we did the ransomware episode, we found out that ransomware changed.
Yeah, I know. It's gotten more aggressive.
It's worse now than it was last week. So now, matter of fact, part of what we were talking about in the podcast was that, if somebody gets a hold of a ransomware type malware, is that going to be a breach? And, there's an argument whether it is or it isn't because the data stays where it's at. We covered all that in the episode, but what we found out is that there is now a ransomware that does physically remove the data from the computer or server and takes it somewhere else, which now is most definitely a breach.
It's the exfiltration.
Oh, yes, that word.
Yeah, that's the one everybody's... it's one of those many words that when we type it, all of the spell checkers go, that can't be right. That's not a word.
And I guess we'll just for the sake of touching on it, it's, your backups, your disaster recovery, almost couldn't say that, your disaster recovery, that is the key to combating that. I mean, without it, if somebody steals your data, physically removes it from your computer, and holds it for ransom, chances are you might get it, might not get it, depends on if you pay it, whatever you do. But if you have a good plan for that, because we talked about, having a plan for ransomware.
Yeah, we got two episodes, one for planning, one for prevention. Which
so if you
I think
do all those things, you'll be okay. Maybe.
Well, now there's the bigger issue, because if these things start sucking data off, it's going to get way worse.
Yeah,
because it's not. I was talking with an insurance broker who said they got a call from one of their clients who the only thing they were trying to figure out, not how to recover their data. No, they had no plan. All they wanted to know was what was Bitcoins, so they could go buy some.
Oh Lord!
And that was how they were gonna get out of this. They wanted to go buy the Bitcoins. They didn't care. They were going to pay the fees. But now I'm curious what's going to happen is, it removes the data and you're encrypting it. So how is it that, it's kind of like they've kidnapped your data and they've taken it away from you and they'll let you have your own little copy, but they're keeping a copy. So what's the ransom going to be for? Let you keep working? Act like nothing happened? Is there going to be, ransom number 1? You get to pick the door. Door number 1, you pay the ransom and you can get back your data. Door number 2, it's a more intense, we'll say, ransom. You get back your data and we will promise to only sell it for half price. Or twice the rate, It's like you got to pay 3 times this and we'll promise, quote unquote, that we're not going to sell it. But it's the point of how valuable the data is, and that's what these breaches are all about. And in this study, ransomware was mentioned as becoming a concern and a rising concern. I think it will now become a bigger one because the study was done, I think, before a lot of those ransomware attacks took place.
Mm-hmm.
But the evolving threats are a primary concern. But still, the majority of the breaches in here were not huge ones. They were less than 500 records. It's the ones that nag at you, that get you, which is, as they said, internal issues such as employee negligence and my favorite, third-party snafus and stolen devices. Still a problem.
Yeah. I mean, you said it in the beginning. It's the longer we go through all these things with compliance and breaches and all that, it seems like we still see the same things over and over again.
Mm-hmm.
And the good thing and the bad thing is that most of them are very, very preventable. I mean, stolen devices is easily preventable because most of them are stolen out of vehicles.
Yeah. And they're not encrypted.
Right.
So, or they're encrypted and they have the password with them. Let's don't forget those.
Or, somebody held them hostage for the password or something.
We never heard any more about that one. I'm starting to wonder,
Yeah, it was kind of interesting. So,
let's hit a few of the big points because we'll give you a link to ID Experts sponsored the report just to see that's what they've done for the last. This is the 6th one, so they've been studying this and tracking it since 2010.
Mm-hmm.
And I should go pull the 2010 and just compare some of the information. But starting last year, they included the business associates. And that's kind of, it's been telling to see how they each look at the data and each other.
Mm-hmm.
But, let's start with the important number. The cost of a breach, based on their estimates that these breaches in 2015, $6.2 billion. That's a huge hit to any industry. And then you have it to an industry as large as the healthcare industry. So that's it's something that deserves a little bit more attention than I think it's getting as far as people trying to prevent it. And when you look at the average cost per breach for a covered entity, $2.2
million.
And then a BA.
Yeah. $1 million. Hold on, let me get my little pinky, put it up on my face. $1 million. Yeah, that's crazy.
Yeah. Hey, I'm a business associate. You're a business associate. Hello.
No, I'm just a podcaster.
That's right. That's when we become Consuela.
Yep.
And Jose. Oh, no, you would be Jesus. Oh, so I could go, oh, Jesus.
Thought that was my name for the first 3 years of my life.
Bless it. So anyway, clearly the cost of these things continues to rise. It's a huge problem. They're not going down, at least. So when you look at it and it's like, well, let me invest $20,000 to save $2.2 million.
Yeah.
Let me invest even $100,000 to save $1 million. And over time, that starts to pay in. But a lot of people are like, well, insurance will pay the $1 million. Do you not think that's going to hit you somewhere?
Yeah, but we've already talked about the insurance and whether or not that's actually going to cover it.
Yeah, because that's getting tighter and tighter because, we do have insurance companies talking to us now about how to vet things and help their covered entities, their policy holders do things. So
yeah. I mean, if you're found in willful neglect, I don't know if the insurance company's going to step up or not.
Yeah, you got to wonder what's going to start happening there because you and I know we're in there and we see it. You saw it just yesterday.
Oh my gosh! I can't even talk about it.
Yeah, let's don't
just
because
make sure head roll.
Yeah. So, yeah, but it wasn't David's client. Let's just say it was somebody that wasn't David's client had him look at something, which then he saw things between a CE and a BA that shouldn't be in an email. Anyway, that's not for today. Let's get back to the Poneman study. So in the stuff where they talk about the response, the cause and detection, all of those kind of things, here's one. 50% of those surveyed, BAs and CEs, 50% have little or no confidence that they can detect all patient data loss or theft. Little or no. Just have some. Get everybody to have little would be better than no. And so, right then, the thing, if we don't even know they're happening, clearly we don't have enough data. We don't know all of it. If they can't detect them all, if we can't find them all, then clearly we're not able to truly look at the extent of what's going on.
And it's probably worth saying too, because we talked about this before we started recording, that these are Q&A surveys that people have to be truthful on. So sometimes I look at these numbers. I don't know about you, but I look at the numbers and go, yeah, that's probably really a lot higher.
Well, yeah, who wants to admit it,
Yeah.
And I don't know if these surveys are anonymous or not. So, but you got to assume that on these that they're going to be fairly honest. But yeah, they're going to leave some stuff out. Well, we won't talk about that one because we never told anybody. We're not going to mention that one, or that we haven't figured out if that's really one yet or not.
Or the person filling it out says, "Yeah, I'm confident." And then the people who actually have to deal with it are going, "No, we're not confident."
No. Yeah, you're right. That could be part of the problem. So for the second year in a row, the number one, the leading cause of breaches has to do with criminal attacks. So 50% covered entities and 41% of BAs. And then interestingly enough, what came in second? A malicious insider, which is essentially a criminal attack. It's just from the inside. Yeah. Before that, it had been loss of a mobile device. And I guess enough people are finally encrypting these things so that, and making them carry the password separate. We've got to always say that.
Yeah, because we have seen people have the password taped to their laptop.
Yeah, we've seen many of those. That one picture you had, and that was one of your clients. That was scary. But clearly, there is a level of employee negligence that takes off into, that happens a lot. Let's just say, because if you're leaving your password with the computer laying in the back seat of your car, come on, at the mall. So I'm just saying. Anyway, so when you look at how people found them as well, so how they detected them and spotted them, between BAs and CEs, they are the covered entities and business associates. Between those two, the same top two. One's CEs say that it's an audit or an assessment followed by an employee detecting it, an employee finding it. And the BAs are the other way around. An employee found it or an audit or assessment. I say the audit and assessments in almost every case should hopefully be employees doing it. So pretty much if you have vigilant, educated employees, that's how you're going to detect them. Mm-hmm. Which goes back to, I guess, that little or no confidence. I don't know what this is. But, without the automated tools, we talk about the Sphere product a lot because it does the automation for you. Mm-hmm. And it, as they say in their, spiel, they'll talk about how they review 100% of the logs. And most people do these audits or assessments on a limited random number of the logs. So, and that's how they're finding them.
Mm-hmm.
Well, thank you for that, David.
I'm agreeing. That's how they find them.
You read the same study. You've read the notes that I gave you. You are correct, Donna. Thank you for reading.
That's all. That's what I'm here for. Hold on, I'll give you applause.
Golf clap.
Little golf clap.
So let's, from a perspective of how can I find them and all of those kind of things, it's things we've talked about a million times. How to stop them, how to find them, all of that kind of stuff. And then when we get to the concerns that they've noted, okay, well, public cloud, mobile apps, BYOD, bring your own device.
Yeah.
Those are all things that every business is concerned about busting down their security, right? That's not just a healthcare problem.
Yeah, you're right. That's it. Especially the BYOD. That's, one of those things that we struggle with a lot in the IT community, because people don't understand that you shouldn't allow everybody to bring their own devices in and out of your network, because, and I don't care what anybody thinks, your phone can be hacked and it can be infected and it can transmit that throughout the rest of the network. But people are constantly letting people come in and get on their network. I mean,
it's just my phone.
It's like, I got an Apple. It can't be. It can't be infected.
It's just my phone. No, it's a computer that can make phone calls. It's another computer. Act like it.
Yeah, cell phones are, you can get the cell phones, but I think they're the flip phone version.
Yeah, that's the old flip
smartphones are not phones. They're computers that you can make calls with.
Yeah, and you need to look at it that way, which is, if I said, are you going to let me put this computer on the network, you would have been a little worried about it. But if I say my phone, you're like, no big deal.
Yeah. It's funny. I actually gained a client a couple of years back because I made a comment about, I was on his Wi-Fi, his public Wi-Fi. And I was like, your Wi-Fi is kind of tied in with everything else. You don't have a guest network. Well, somebody else set it up that way. It shouldn't be a problem. I said, really? Because I'm scrolling through the files on your server.
I'm right now looking at them.
Right now, here they are. And he said, how much do you charge? So that was interesting. He panicked.
Yeah. Well,
but anyway,
that's what it does.
I digress.
Yeah. So
vigilant.
Yes.
Let's be vigilant.
Don't let some goober out there wandering around on your network like David. So
that's what happens when I have to wait too long. Start scanning for stuff to do.
See, and now there's so many people that know how to do that. So the other big thing that everybody's concerned about outside of those things is that healthcare has a big giant target on their back. Mm-hmm. And we've talked about that. And what I thought was interesting is when they look at the reason why CEs and BAs believe there's a target on their back. So here's the good part. So CEs overwhelmingly believe that covered entities are not vigilant in ensuring their partners and other third parties protect patient information. So that's what they believe, that they're not making sure. The number one thing they're concerned about is they're not making sure that these third parties are being, vigilant. Like, I don't know, a BA due diligence that we talked about a million times. That no one's ever asked me for this. So, but here's the flip side of it. Business Associates' number one reason they believe we have a target on our back is that healthcare employees are negligent in handling patient information. It can't be the third parties. It's the healthcare employees. We see what they do.
So we see fingers pointing at each other here already.
And the second thing for BAs is that healthcare organizations are not investing in technologies to mitigate a breach that you generally buy from a third party. I'm just saying. But in relation to that, the secondary one for covered entities is that they are not hiring skilled IT security practitioners. Skilled security people. There's a shortage in skilled security people that are good guys.
Yeah. That's true.
There's a ton of them that are bad guys. But, it's like a testimony that I saw on C-SPAN, because I'm a nerd. that one of the heads of the military cybersecurity programs and the congressmen, senators, whoever were quizzing him, and ask, why do you think that we have a hard time keeping these skilled individuals? And he looked at them like they had 5 heads. He's like, do you know how much money these people can make out in the public sector, or the private sector rather, and you're wanting to pay them maybe a third of that in the public sector? I mean, there's such a shortage of these people that as soon as the only ones that we're able to keep long term, because they get lured away by the big organizations, are the ones that are truly committed to protecting their country. Mm-hmm. Which, when you think about, these young kids that spend their whole life playing computer games, and then they get a good bit of training on security through the military, let's say the Army, whatever. And so they spend 4, 5, 6 years on their commitment there, and they get out and they instantly make, mid 6 figures. It's not unheard of. So that shortage there is clearly a problem. Mm-hmm. And if I had it to do, anybody that I talk to now that's young, I'm like, you sure you don't want to go into computer security? Because you really should think about computer security. Yeah. With us, they were like, hey, you're going into computers? I don't know what's going to happen with those computer things, but it sounds like they're going to be big. So
I heard the internet was shutting down.
They're gonna shut it down. Oh God. So clearly, everybody agrees that healthcare has a target on their back, and pretty much it's all about that. They don't worry so much. They don't think that the biggest reason they have a target on their back is that the information is so valuable. It's like everybody knows it's valuable, and there are tons of people that have valuable information everywhere. It's just that we're so bad at protecting it in healthcare that makes it a big deal. Or at least that seems to be the opinion based on the survey responses, or my assessment of the survey responses.
So it's not just that it's a big target, but it's an easy target.
Yeah. The information is quite valuable and more valuable than most, but that's why you would expect it to be protected better. And the protections, those of us that work in it day in and day out, we're like, I can't believe, these small businesses, they're horrible at it, but you give me 1,000 patient records, which was another thing that showed up in the survey, that the number one thing that's the target, it's not payment information, it's the medical records and billing, which has the medical records in it. So it's how did it get billed, not who's paying for it, but how's it being billed, because I can bill that too. Or in the medical records, I can do a million things with it. So that is the target. And when a lot of people worry about the target being, it's payment data, it's financial data, and that's why they'll say, I don't really have any of that. I don't keep credit cards. Yes, but I have 20,000 patient records. No credit cards, though. So I'm not So the issues of not being vigilant and making sure the third parties are doing their job, as well as having well-trained and vigilant employees, seem to be the big things that need to be changing. But I don't know that they are changing. I think people are trying to figure out how to change it. But, it's hard to change a lot of things when you're already battling this onslaught of activity and attacks and people doing stupid stuff. And I just had to look. I wanted to know if she was really sick. When you're covered up with all of that, the important thing is that these people are barely keeping their heads above water, managing all of this data, whether it's the tech people who, by the way, overwhelmingly, everyone says the ultimate responsibility in dealing with a breach goes to the IT people. Go figure. They're the number one party we're going to dump everything on. And We
don't want to invest in it.
Yeah, we're not.
But we want to blame.
We're not going to give them any tools to prevent it, detect it, or manage it when it goes wrong. And we're not going to give them enough resources just to handle the help desk calls. And when they do ask for something, we're going to complain about the fact that they can't do it faster on their own. So, but you know what? We're preaching the sad little tech people story. Same thing happens with compliance people and clinical people. It's the people just trying to do their jobs. But when you look at the amount of attacks that are happening day in and day out that you and I see, I mean, this week our website's been just being pounded, and I'm having to spend a little extra time making sure everything's all okay, because you when they're coming at you from every direction, no matter what you do, it does become distracting.
Mm-hmm.
So clearly there needs to be a lot more oomph in the process, but almost
a little more budge.
Yeah, the budgets didn't change. In fact, some of them decreased. So 10% of the budgets decreased. 52% stayed the same with covered entities. With business associates, 11% decreased and 50% stayed the same.
Wow.
Yeah. So
that makes no sense.
Well, it does in that, a lot of people just think the computers are supposed to work forever. And they don't, and the trying to describe patch management to people it's crazy. Oh, I can do that manually. Really? Really? Do you realize how many things really need to be patched and have releases coming out every day? No. I mean, we need to try to explain patch management like we did antivirus, which we did get some positive feedback on our antivirus and anti-malware discussion. We'll go no further than that. So overall, what the study showed is the attacks are coming. They continue to come. They're, increasing. If anything else, they're not decreasing. Everybody knows that healthcare has a target on their back. Everybody knows that healthcare is not doing enough. They don't hire the staff. They don't hire the skilled staff to do anything with it or buy the tools because they're too expensive or whatnot for the budgets and those kind of things. Yet, when it goes wrong, it's several $1 million. So we're pretty much riding on the knife edge for some of these small businesses that are out here doing it. And again, those quotes are for the $1 million. That's trying to look at everything, not just a fine or a penalty. It's lawsuits and legal fees and
damage to your business and
damage reputation of we do love you and care for you. Please come back. But there's some big numbers that show that patients will leave and consumers will leave after you've been well known, and especially in a smaller community.
Mm-hmm.
It's like you can't really leave Blue Cross Blue Shield on your own when they have a big one. But a small practice or business associate, you can lose all your business.
Yeah. I said in a previous podcast that I feel like that what will eventually move the needle will be the patients and the public that will finally start saying, look, unless you're going to really treat our information with the utmost privacy and security like you should be doing, we're just not going to do business with you. There's too many other options out there for them to go do business with somebody else.
Well, there's a school of thought that, it's kind of like people will rise up. But what I'm hearing is, I've given up on that. My stuff's out there everywhere. Please don't do that. Don't do that, please.
I've heard that too.
Because every day you're creating new stuff. If you give up, all your new stuff will keep being thrown out there too. So, we don't have a fighting chance if you do. And once you have your identity stolen, once you deal with what's happened to some of these people and you hear about how things have happened, it's awful. It costs individuals $13,000, $14,000, $15,000 to try to resolve some of these things. Cost them.
Mm-hmm.
So the next time you say, "Oh, my stuff's out there, I don't care," remember, you're kind of agreeing at that point. Lack of disapproval implies approval is what I always said. It has come in handy. Well, you didn't say don't do that. You saw me going that way. But if you continue to accept that this is going to occur, we as consumers and patients or whatever, and we don't ask about it or say something about it or even try to encourage people to do a little something different, it's really going to affect all of us in a way that, I'm going to guess anyway, that people, when it happens to them, that's when they're going to get angry. And classic American fashion, we'll forget that we said it was okay.
Yeah, we do have short-term memory loss.
Yeah, I didn't say that. I didn't do that. What are you talking about? Oh, you mean like 5 minutes ago? That was not me. It wasn't me. That's a classic thing. Or I misspoke, or you misunderstood. Yeah, but we're used to it. So there you go. I've been preaching long enough.
Oh, very good. Man, lots of stuff. I'm glad we got to dive down into the breaches.
I knew it. We cannot have one whole breach episode and you say nothing. You always like doing a deep dive in the breaches.
Oh, boy. Well, before you take me off track somewhere, let me go ahead and close this out. So that's our episode for today. I hope you enjoyed it. And if you did, head over to iTunes and give us a review and share it out on your social media platform of choice. Yes. Thanks everybody for listening. And don't forget, head on over to our website, helpmewithhipaa.com. You can leave us a message right there on our webpage, and we might feature your question in a future podcast. And we thank those of you who have already left messages, and we have answered them. Come back and listen to the other episodes. So that's it for today. And Donna, anything else?
No, I got nothing.
Yeah, we're good to go. All right. We're done.
Good evening, David. Good evening.
Yeah. Good evening. Good night. So for Donna and myself, remember, HIPAA is not about compliance. It is about patient care.
Au revoir. Auf Wiedersehen.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.